This video will cover general features of AML, or acute myeloid leukemia. The anchor for this video will be really important because there will be a series of AML videos and they will all have the same anchor to help us remember AML. The anchor is this amulet here because the word amulet has the letters A, M, and L. Let's burn this into our brains now and remember that every video with this amulet is an AML video. Let's begin. Most adult and infantile acute leukemias are myeloid. The median age is 65 years. To represent this, we have our main character who appears to be right around that age. Additionally, he's wearing this t-shirt with an infant on it, which can help us remember that acute leukemias in infants are usually myeloid. Only 10% of childhood acute leukemia is myeloid, so don't get childhood and infant acute leukemias mixed up. I'm not going to have a prompt for this, but I think it's worth just covering really quickly. AML usually presents with a very elevated white blood cell count, and the blast percentage must be greater than 20% to be considered an acute leukemia. There are exceptions, but in general, this is the rule. Okay, now all we have to cover is the typical expected immunophenotype of myeloid blasts. Let's start with CD33, which is represented by this dirty tree here because doesn't dirty tree sound like 33? Next is CD34. Same deal, but instead we have a dirty door, again because the number 34 sounds like dirty door. Next we have CD117. I'm going to reuse a prompt that has been previously used, which is this first aid kit. If you remember from prior videos, the first aid kit is a symbol for C-kit. Since C-kit and CD117 are interchangeable, that's what we're going to use. Another important CD to remember that is expected to be positive is CD13, which we're going to remember with this Friday the 13th movie DVD. Lastly, HLA-DR. Well, our main character in this image is this doctor. Maybe he's a pediatrician because of the shirt he's wearing, or neonatologist, who knows. But for our purposes, all we have to remember is that he's a doctor, or DR. And look, he works for a hospital named HLA. Put the doctor together with the hospital and you get HLA-DR.